Thank you for accommodating.
Hope you feel better soon.
Thank you. I'd just first like to inquire if we have a quorum.
We do.
As we do, I'd like to welcome everybody to the March 25th, 2026 Metro Plus Finance Committee meeting. Start off with old business. I'd like everybody to get their approval of the minutes of the December 10th meeting from 2025. Do I have a motion?
So moved.
Second.
All in favor?
Yes.
Aye.
Aye.
With that, I'd adopt the minutes for the last board meeting, and I'd like to move to new business, starting with the first resolution.
So the first resolution is for the approval from the board of 4 new contracts for legal services. Metro Plus last solicited legal services contracts 5 years ago in 2021. So we were up at the end and didn't have any extensions available. We issued an RFP. We received 5 responses. Do you want me to read through the resolution or you want me to go through the deck? I'm sorry.
Well, technically, usually I read the resolution.
Oh, do you? Okay.
Yeah, and then-
All right.
And then we go through it, but you jumped right in. I didn't want to stop you.
Yeah, no, sorry about that. Okay. So
All right.
the resolution authorizes 4 contracts for law firms for a 5-year period with a total not to exceed spend of $2.5 million. Okay, you can go to the deck. Okay, so I said there 4 firms were selected: Greenberg Traurig, who is an incumbent vendor, and who is our primary day-to-day counsel, and will remain our primary day-to-day counsel, assuming approval from the board. The other 3 firms are Hinman Straub, Scher Tremonti, Tarter Krinsky, and Drogan. We're looking for authority for not to exceed $2.5 million for a total of 5 years. For a little historical context, in 2021, we received authorization for $2 million, and the total spend under those contracts has been $1.65 million, which is an indication that the authorization is a not to exceed. It is not a goal of ours to spend or to try to reach. We use outside counsel as we need them and as we think is appropriate. The increase in authorization from 2 to 2.5 million is basically a result of the increase in hourly rates. We had hourly rates set in 2021, and I'm told Greenberg Traurig is actually billing the same rates that they billed in 2021. So those rates are going up, taking a 5-year increase. And then we also have a little bit higher rates for the other 3 firms. Next slide. So, the scope of work is all of the various possible legal services that a company like ours could have. It involves counseling, regulatory compliance work, advice. It involves litigation in some instances, HIPAA, cybersecurity, anything that we need from a law firm that we don't have in-house, or from H&H Legal, or to some extent from the New York City Law Department, we would get through these law firms. We are not guaranteeing work under these contracts. It is an as-needed basis. As I said, Greenberg Traurig will remain our primary day-to-day counsel. We'll utilize the other firms depending on their expertise or the type of matter. Greenberg Traurig will continue to get the bulk of the work here, but when we have individual matters where they either have a conflict or whether we maybe want a different kind of a check to see whether there's a different possible approach. And then in particular, when we have litigation or desiring to have litigation, they definitely have litigators, and I've had pretty good success with them. I have a good feeling for them, but that's not really their specialty. I mean, they've won this contract predominantly because of their counseling and regulatory work, and their lead counsel, Harold Island's experiences and contacts in Albany. So when we do litigation, we'd be more likely to use the other firms. Next slide. I'll note that we did, the criteria was that they have firms have at least 25 attorneys. wanted to have a broad enough base to work from so that they could handle work and it wasn't dependent on individuals. And at least 5 years experience with managed care organizations. The criteria, pretty standard mix between experience and cost at 65-35. Next slide. So we issued the RFP. We sent it to 9 firms. We received, and we also advertised it in the city record. We received 5 proposals. All of them were met minimum qualifications. We interviewed with 4 firms and we awarded the contracts. We're proposing to award the 4 contracts. The evaluation committee was Metro Plus Legal, Metro Plus Compliance and Regulatory, and also H&H Legal. All of our contracts, all of our legal services contracts, regardless of value, have to be approved by the H&H board. So we included H&H Legal in that as well. And so our request, as I said, 3-year contracts, 2 one-year options. Anticipated start date will be April 1st, give or take for the other 3 firms. Greenberg Traurig will keep working. And it's 2.5 million. One thing I will note is that we did not put an MWB goal on this. We don't really want law firms subcontracting. So that's not, so that sort of a subcontract is not our, was not our goal here. We did check the MWB lists on that the SPS maintains to check to see whether any MWBs would have met our criteria. There are no certified MWB law firms that specialize in Medicaid or managed care or anything like that. We didn't find any of those to contact. And I will note that it's the same decision that H&H reached when they solicited their legal contracts last year. I think it was last year. It was either last year or the year before. They did an entire solicitation, awarded all new contracts, and did not set MWB goals.
And Andy signed off on that, so it's not any controversy at all, right?
Andy definitely signed off on it.
Right.
I certainly hope it's not a controversy. I can't speak for the board, H&H board, not all of whom I currently know. So.
No, but I mean, as a former H&H board submitter, I mean, I know we're very, it's consistent.
Yes.
So it's one area where we do deviate from that requirement.
I don't anticipate, I mean, because it matches what H&H does, because we couldn't find anybody on the lists, because law firms, you don't really want to subcontract, it all makes sense. I mean, it is, it should not be, let me re-say that, it should not be controversial with anybody.
I'm just trying to confirm that for everybody.
It was posted in city records, so they had the opportunity if they were.
Yeah.
And sorry, I said they was posted in city record. It wasn't just a negotiated acquisition and went to a certain group of firms.
Right.
So they had, if there were MWB firms, they had the opportunity to propose as well.
Yeah. All right. Any other questions about this one?
No.
If not, I'll bring it to the board for approval. So do I have a motion to approve?
So moved.
Second.
All in favor? Aye.
Aye.
Motion's approved. I'll bring that to our next item, authorizing the Executive Director of Metro Plus Health Plan, Inc. to execute a contract with Health Management Systems, Inc. for third-party health insurance identification and recovery services for an amount not to exceed $15 million for a total 5-year contract period. Lauren?
Yeah.
Tali's going to present.
Oh, okay, Tali.
Right. So Metro Plus is seeking a best interest contract with Health Management Systems, or HMS. They are currently our third-party health insurance identification and recovery services vendor. We require these services to maximize cost savings through cost avoidance with proactive identification of undisclosed coverage prior to claims payments. The services are currently provided across nearly all of our lines of business, and as part of this new best interest contract, we plan to extend the services to our essential plan line of business as well. So we're seeking an authorization to execute a best interest contract with HMS in the amount of $15 million for a 5-year contract period. Next slide. Metro Plus has successfully partnered with HMS since 2011. We've run 3 different procurements for these services, and HMS was selected each time. They are a national vendor and one of New York State Department of Health's TPI services vendor. The main reason why we took into consideration continuing with our incumbent vendor instead of initiating a formal RFP process is because through renewal discussions, the vendor did provide us with pricing reductions, and we're able to secure these pricing reductions for future years by executing a multi-year agreement. And also during our duration of our relationship, they have not implemented price increases on us, so they do demonstrate a long-term pricing stability and continued value. The other factor that played a part in our decision was that we're currently undergoing the Project Edge core system implementation, and we've already configured and tested HMS files that for wave one, and we will have additional files and additional configurations for the subsequent phase. These are some of the cost reductions that they have offered to us. A 10% reduction compared to 2025 rates across all LOBs overall, on a fee structure improvement of a 1.5% reduction in vendor recovery fee structures. And specifically on transaction costs, they've reduced our record ads by $2.50 per record and our term records by $15 per records. So our ask is seeking a 5-year contract. We do annual options to renew with the vendor. And our anticipated contract start date is May 1st, 2026. The total authority amount for the 5 years is $15 million.
Okay, do I have any questions from any of the members of the board?
Nope.
If not, I would look for a motion to approve.
So moved.
Second.
All in favor? Aye.
Aye. Aye.
Okay, it's moved, and we can go to the next item, authorizing the amendment of the best interest contract resolution approval by MetroPlus Board of Directors on September 26, 2025 with SourceEdge Solutions, LLC for data migration and conversion professional services for an amount not to exceed $2.3 million, including contingency for an 18-month contract, and authorizing the Executive Director of MetroPlus Health Plan, Inc. to reallocate the approved spending authority and execute a best interest contract with SourceEdge Solutions, LLC for implementation of a solution for converted data testing in the amount of $2.3 million for a 1-year term. Ganesh?
Good afternoon. So as the board is aware, we are in the midst of a Health Edge implementation, moving away from PowerStep and CareConnect, and we are transitioning about 3 years worth of data into the new system. We do have an obligation to be able to do a further look back in our data beyond the 3 years that's going to be carried into HRP. And so originally what we did was we asked the board to provide an approval for us to engage with SourceEdge to take that database, have data beyond the 3 years up to and including that 10 years worth of data that we should have, and develop for us an interface so that individuals within the plan can do a read-only lookup of any kind of claims or auths that were not currently in HRP. Since that time, and the reason we did that also is because the app dev team was really busy with HRP implementation, Salesforce implementation, a lot of other implementations. But we saw an opportunity to leverage some of underutilized resource. And when I say underutilized, they're under 125%. So, so we did take the initiative to build the system out internally instead. And so now we've saved this $2.3 million. We no longer need to leverage that $2.3 million for that purpose with SourceEdge. But what we're asking the board to authorize us to do is move that amount of money still with SourceEdge to do some data testing. One of the shortcomings in wave one was around data testing. It is extremely complex data that is moving, and it's 30 years worth of legacy data that has been manipulated and created And this 3 years worth of data that's actually being pulled in there is based on all of this configuration and everything that's in there. So because of the shortcomings in our data testing that drove this wave much longer than it should have, what we're proposing is to reallocate that funding to SourceEdge, who knows our data because they are the ones that are helping us convert this data into HRP, and allocate this funding for them to be able to do that and do all the testing, as well as build up a repository of test suites so that we will own those test suites for any subsequent waves that we have to do as well. And so not only are they building us this test suite, they're doing the testing with us, and then we will have ownership of the capabilities subsequent to the implementation. I think I captured everything that's in the first 2 slides.
Yeah.
So again, to summarize, what we're looking to do is to amend the previously approved authority and execute a 1-year agreement with SourceEdge in the amount of $2.3 million for data testing services, inclusive of contingency.
So I just have one question about the magnitude. I mean, understood we freed up the money by doing internal work. How do we know that this is the amount of testing services we need? Is there a possibility we need more than this? Or
So their proposal was less than this, and we added some contingency into it to build this up. But based on their proposal, based on their rate card, we believe this would be sufficient.
are there any questions from any other members of the board? All right. If not, I'd ask for a motion to approve the contract.
So moved.
Second.
All in favor? Aye.
Aye.
All right. So we're approving this and moving to the final resolution, authorizing the executive director of Metro Plus Health Plan, Inc. to increase the spending authority for the contract with SourceEdge Solutions, LLC, to implement, integrate, and license an enterprise data hub solution in the amount of $720,000 for a new total not to exceed authority amount of $2,957,000 for the remaining contract term.
So again, to kind of level set with where we are with SourceEdge. SourceEdge is one of our best implementation partners on this HRP implementation so far. They've gone above and beyond everything that we've asked them to do. But because of the fact that we have elongated our wave 1 implementation, it took additional resources from SourceEdge to be able to migrate a lot of the data out of PowerStep and CareConnect into HRP and Guiding Care. And so as we're continuing into wave 2 and potentially into wave 3 later on, we need additional funding to help offset some of the costs of this implementation from SourceEdge. So the board of directors originally approved the resolution in 2024 for an amount of $2.2 million. We are looking to increase that value by an additional $720,000 for a total not to exceed is $2.9 million for the additional work that they will be performing. And we've also carved out some aspects of the software that they provided to us so that we have a little bit more of a runway in the ability to fund their activities over the next year around this initiative. So they we call that specifically Datachrome, which is a proprietary software owned by SourceEdge, developed by SourceEdge, that we will have to continue to license anyway. And so we pull that out in order to add some additional capability in terms of financial capability to pay them for the additional work, plus the $730,000 that we're asking for. So this should bring us to the end of the year and not have to go back to the board again for additional costs. We may be back here again next year, but in 2027. But right now we're trying to carry us over to 2026.
May or definitely, if this is going to exhaust the funds for SourceEdge, because we know we have wave 3.
Yeah, it's definitely.
We will.
Yes.
Okay. So I guess my next question is a broader question, and it is, when do you think we'd be getting our next update on the status of the program, of the whole initiative for the board?
So we are expected to go live in August of this year with wave two. We will continue to update the board at the board meeting. Tomas has a update as to where we stand currently. Wave one was implemented in December. We have stabilized now as of the last couple of weeks or so. Truly, stabilized as of last week. We called it done for stabilization. Configuration of wave two is between 95 to 100% done. There's a couple of things that are still outstanding. We're starting testing next week. Tomas will give a more in-depth status as to where we are and the path forward and the various waves, right? Wave two, the BPAS wave, and wave three in 2027.
Fred, I also asked, and Lauren prepared, we can get it to you as well or to the board, just the amount of money, how much we
Mhm.
how much we spent, how much contingency. So we should have that for tomorrow. We'll get it to you too.
Okay.
All right, to summarize again, we're looking for an increased authority of 720,000, bringing the total contract authority to 2,957,000 to run through December 31st, 2026.
Okay, if there are no other questions, I'd ask for a motion to approve.
So moved.
Second.
All in favor? Aye.
Aye.
Okay, we're approved. And with that, we'll take it to Lauren for new business.
Good afternoon, everyone. So this is a presentation of our 2025 year-end experience that will officially close on April 1st. But we have concluded our review with our KPMG partners, another clean year, Fred. And so that will be the presentation at Audit and Compliance tomorrow. I will just start with some highlights on the 2025 utilization. Overall, it's slightly down, but where we're making a note is on the HARP SUD. It did surpass our prior year experience by 6 points. We're seeing that the inpatient maternity birth rate is rising in Essential Plan. That was a new benefit carve-in, so that coming up from nothing, is significant. And then we are seeing a slowdown in Medicaid, a 10% year-over-year slow birth rate. On the outpatient side, mostly behavioral health outpatient for Essential Plan, an increase of 16% year over year, and CHIP 26% year over year. Across all of our lines of business, we are seeing an uptick in the utilization of behavioral health services in our population. Emergency room utilization slightly lower versus prior year. We did see a December flu surge, and that was especially impactful to our ED visits. For primary care and specialty care, we do like to hold the benchmark at 4 visits. We are seeing that our members are upticking an increase year over year. Our benchmark does sit at about 3.1 visits per member. And then on the LTSS services, we do see on the PCS and CDPAS growth slowing down. There are signals of stabilization with our new PPL partner. Next slide. Just some general rate updates since we last met. The New York State has issued an update for the MLTC line of business. This includes a marginal decrease to the April 2025 rate. They're essentially continuing to normalize base and trend updates to reflect their shift from the CD pass to the PC services and the FI carve out. On the MAP side, these rates were most concerning across the industry. This is where we're seeing the development of negative trend come through from the state actuary department, and they're calling for a 3.8% decrease from our April 2025 rates. In total, that's a $1.4 million annual decrease. We have a very small population in MAP, but on the individual member, this does have an impact to Metro Plus and our experience to the operating budget.
Lauren, remind me, when we reviewed 2025 yesterday. This was already incorporated?
This, these rates, no, this is April 26 rates. So these will issue next week.
Okay, so then are we gonna restate then 2025?
Are we going to restate 2025? We are just stating, so our 2025 rate action includes the 8% reduction that we took earlier on in the year. And then this is our first signaling, Karen, correct me,
These are our April 26 rates.
our initial state
Oh, this
fiscal
one.
year rates.
That's
From
April
April
25.
of
Right.
20. Never mind, never mind.
Thank you.
Sorry.
That's okay. We keep going. Listen, on the next page, we're going
It's
back
the
to
third committee
25.
meeting, so.
So next slide, Angela. So on this slide, you have the April 2025 version 2. Medicaid and HARP rates. We did see another increase of 1% and 0.6% increase. The initial rates that we had seen above the April 2024 rates were 9.9 and 1.2%. Respectively, they are a huge uptick from what we have seen historically from the state's drive. So them normalizing even on an uptick here for the statewide fiscal intermediary add-on of the adjustment to their fee schedules was, welcomed and expected. On the next, can you scroll down just a smidge? So on the HIV SNP line, we saw 2 updates, a 2024 version 2 and a January 2025 update. This was a 3% reduction due to post-trend updates and the inclusion of the MCO tax. The state is adjusting for the dual population. These are the count of dual members disenrolled after the unwind. So the impact here from the previous rate is $2.3 million.
Lauren, if you had a crystal ball, based on the fact that they went back and added another 1% for Medicaid and HARP, what do you think the rates are gonna be?
So we did add into our forecast, we have a 6% revenue expectation. It aligns with industry discussions that created a range between 6 and 8%. There has been some other chatter, now that the essential plan waiver has been extended and the pressure for not having to include, a bulk of the EP members into the Medicaid book of business, that those, rates are feeling stronger now. So I do stand with our number that we have in our forecast at about 6%. But the state delayed them. They were supposed to issue this week. They have delayed them with as soon as possible message. So it could be anywhere from April to June when we will see the first issuance of the new rates. Next slide. So on the risk adjustment front, this is the area where we document our population's acuity through chart review activities, and we do have a partnership with our vendor to assure that we are actively reflecting that group. So through CMS, we have seen an increase of 3% on the acuity of our overall population. There will be increased focus coming into effect immediately, where they are going to be looking and changing the rules on how risk adjustment is substantiated in the CMS realm. On the QHP line of business, this is our ACA individual line. We did have our most successful RADV audit ever. This is our 5th year in a row, reducing our error rates each year. By 2025 deadline is April 30th, 2025. We are working to assure we meet, our data is accurate and we meet all of our expectations prior to submission. The CHIP line of business is a new risk-adjusted program in New York State. 2 years ago, they regionalized the rates and now have moved this into a risk adjustment program. Our initial scores for payment year 2025 were below regional average. We are taking mitigation steps to assure that our population's documentation meets their acuity. And then on the HARP and Medicaid line, we did have increased engagement with H&H this year. It did, we do expect it to yield improved data and, more accurate submissions to New York State. And, upon the issuance of the new rate action, we will see our 2026 risk scores. And then on the essential plan, we have a very, again, strong partnership with H&H on member engagement and data submission. And we are the, #1 acute plan in our region when you look at our risk scores across the board. In terms of financial performance, we have had a strong performance year over year. Overall, we had 691,000 lives across $5.3 billion of revenue. We did close the year with 90.9% MLR and a 7.3% ALR. We do have the box on the left is the total of $285.7 million. That is the sum total of our current year operating performance plus any prior period write-ins below the line to your net income of $285. You could see year over year how that story has flipped a bit. Our current year operating margin aligns, with last year. We had about 2.9% this year. Last year, we were at 2.5%. We are seeing some positive contributors to certain lines of business where for Metro Plus Gold, we saw a 13% increase in the overall lives. And then we also saw the increase in the Medicaid revenue that was, above their historical performance, and then the essential plan lines of business. Overall, our prior period adjustments did include IBNR release from prior year. I think there was the rollout of the public health emergency and the uncertainty around what would happen contributed to that IBNR release. We saw a significant amount of payments for UPL, ACR, and distressed hospital come through our P&L and balance sheet for 2025. And then we had a release of a penalty of about $40 million for EIS to MCOR reconciliation, realizing us an overall net income of $5.3 million. Next slide. So, how you compare that to where we expect it to be across all of our lines of business, essentially on target. On our membership, we anticipated to have closed the year at 695,000 lives. We closed at 690,000 lives. That, again, driven by the fact that we had, better than anticipated performance on our Metro Plus Gold line of business. And then we saw increased tightening in the Medicaid line of business as well. And then towards the end of the Q4, we saw a spike across our essential plan. Revenue, the driver there, again, would be the Medicaid deviation for the unexpected revenue. And then on the expense, there is no material deviation, even with trend, we're essentially on target. Administrative expenses, small net savings across the organization, and our investment income aligned to expectations. For state-directed payments in this particular year, across all of our state plans, we received updates to our book of business as we knew at the time. And then there are lines of business, Gold, ACA products that did not include the MCO tax that are included in the 2026 year. The state did not entertain the increase for any other lines of business at this point, yielding our overall operating income of $19.20 after aggregate write-in and those pass-throughs, admin and release. We yielded a $34.69 net income. Next slide. So on the administrative expense, very lean admin budget at 7.3% ALR. That is driven by some savings. We were 6.6% favorable. 14 million of that, which was driven by our PS savings, and 12.1 of that through our OTPS. We had to, given the state of the budget, where the actions are, we had our PS favorability was driven by a reduction in our non-essential vacancies. And then on our OTPS side, there was a delay in timing on, a number of collaborations and printing and postage charges to make up the delta. So on our VBP deals, which is this includes the H&H program, Metro Plus retained risk, and then our third partner, which is Somos VBP. There is a 21.6% improvement year over year across the board, and so there is savings through better concentrated oversight on Metro Plus's retained risk, assuring that there is members are being assigned and attributed in the right places from the jump. We see that Somos has an improvement. Their improvement is due to their own performance through their gateway. So as part of New York State VBP deal, there is quality performance metrics that you have to measure to in order to generate the shared savings value. And we saw a significant improvement from them year over year. And then our membership. So our membership is tightening. It is tightening, but it is following forecast assumptions. We spent the better part of last year hovering at around 690,000 lives. And we are still, hovering there. We are making up differences in other lines of business to keep up with our forecast. But as the year progresses, we will continue to see a decline in our overall lives. Metro Plus's forecast of 2026 is a 637,000 life count, and that will be the primary drop because of the EP5 population. And then on market share, you can see on the left side, the partnership and care line of business, is growing. We're seeing a nice pickup in the market share up to 27.2. The HARP plan had a reduction in our overall lives down to 16.3%. There was over the summer, there was a reduction in the HARP lives where post public health emergency, they were no longer eligible for that line of business. So that was an anticipated cut that also hurt in the market share. Medicaid remains stable, still at 16%. What we're seeing is that, everyone in the market is declining. There is one plan that is not, but the base is stable. So the retention is there for us to achieve. And then just in general on Child Health Plus, that had a more significant reduction of 2 points in the market share. There is driven by the loss of eligibility in some parents, and then Roger noted just general churn and getting them to recertify. Our Medicare line of business had a good open enrollment. I think it was as expected and strong. We grow about 1,000 members a year in this product. We're looking to beat that, but still maintaining our market share there. We have a very competitive product out in the market. And then MLTC. And then last on the agenda is what is to come. Actually, I think there's two more of this. There is, these are the items that will be going out for solicitation, and the timeline that they, will be released upon. So, it is very broad scope of items, but you can see that our PBM services will be coming out to bid in Q2 of 2026. We're looking for SIU services and other EDI transaction items that are slotted for Q2 or later in the year.
Thank you.
Wait, I have one more.
Yeah. Provider numbers.
Okay, and then just our provider network. So this just gives you the landscape of our footprints, then the current practitioners that are added to the network. So we are 32,000 lives, doesn't include the dentists, and it does include all locations that we have within our footprint and our slightly, outside counties of New York City. But in total, we added another 1,000 providers across. It was a 3.63% overall add. Across the board for Metro Plus, for providers that either were added through collaboration to make sure that we had all of the providers, part of the group loaded in our system. It was through new contracts, exercise. We were able to align an additional 5,200 providers across the overall network. So it is good work that is happening in there. More to come from this division with, good partnership and strong expectations to close gaps and provide our members the most choice we fiscally can. And that concludes the Q4 2025 presentation.
Maybe a good opportunity to introduce the new
Yes.
VP of contracting.
Yes. So this is Bob Nolan, our new VP of Network here at Metro Plus, has joined us about 5 days ago. So he is brand new to the fold, but is quickly getting into shape. Would you like to say a few words?
Thank you. I recently, for the last decade, was at a hospital for surgery. Before that, I was on the health plan side at Oxford Health Plan, Centene Corporation. So I've been, I think somebody said to me earlier this week, you've been around.
Lauren, I may be misremembering. I thought the state was going to free up a reserve to cover EP5.
So in order for, and Raven, I will go first. Raven will back me. So the Essential Plan group, in order for them to go back to the original basic health plan waiver, they had to drop the EP5 group, and they are no longer eligible. So that unfortunately is 450,000 people that are no longer eligible for coverage, and the state is actively trying to figure out what to do, but there is no solution at this time that has emerged as a leader for the best path forward. It is a trying time because people have lost subsidies and they're already heating the expensive premium. And once they will leave Essential Plan, which does not have a subscriber component, which does not have cost share, will find themselves in a QHP situation with a premium that is
It's untenable.
It's untenable.
Yeah, I think, Sally, you're referring to the trust fund. And so the trust fund, basically, in order to get EP5, New York State had to give up access to that money. So billions of dollars were sitting when they couldn't touch it. When New York State approved them to go back to a standard BHP, which is what we had before 2024, and EP5, that was all part of what was contingent on them being able to access that trust fund, but only to fund EP1 through 4.
I see.
There is no, if EP5 continued to exist, they would have continued to not have access to the trust fund. So it was
I
that
see.
trade-off, basically 450,000 lives for, more than for a couple million lives that are in the rest of the product. And
Thank you. Thank you.
Are they still considering options? I thought they were out of options at this point.
They are out of options in terms of the federal level, but what the New York State Legislature can do are there places in their budget again. So a lot of budget contingencies were being framed around the idea that if CMS did not approve and everybody, especially in the Aliesa population, would have to go back into state-only Medicaid, they were allocating dollars for that. So now they're, I think, trying to see with no subsidy approval, no retention of EP5, is there something they can do with state dollars to help that population on those premiums, other subsidies in general, but it's still entirely out there and no sense of what they might actually be able to achieve. Yeah, it's quite complicated.
I don't know how, I mean, it's just impossible to make up for all of the federal losses.
Yep, it is.
Yeah.
Because there are a lot of people who need that support, so.
Right, and it's not just the 450,000 who are leaving EP5, everybody else who falls into the categories of individuals, right? They don't have the subsidies anymore because the Congress has not approved an extension of those subsidies for QHP. So people are paying
Right.
full price across the board.
So it's all of it. It's all of QHB
Yes.
5, and it's 1 through 4 that they will be using the trust for.
Correct. So 1 through 4, they think they can fund as is, no changes, even to benefit structure, for the next at least 3 years is what they proposed. But everybody who was in 5 and EP5 and everybody in QHP is in a more expensive, less tenable environment now.
Okay.
Is there any other questions of the members? Any other new business?
There are, to speak to people who know, there are 2 matters that are going to the board in executive session, and do we want to deal with them here in an executive session?
I mean, they are finance related,
They are
So,
financial and results of account.
I think it makes sense, yes.
Okay.
So,
So we have a motion to go into executive session?
Yes.
Right.
Okay, so let's proceed.
Everybody but
everyone knows who knows that they should be here.
Steve upstairs. Thank you.
We're where we go.
Awesome.
Thank you.
Yes, yeah. And then we'll go. Okay, both of them.
Are the noise machines on?
Yeah, it was just about. The OLR savings? No, what did they save?
This meeting.
Right now, right. No. Okay, well, good for them.
Really? So when you're.
What did they do, James?
Your mic is on.
So the ineligible dependents, they probably are thinking.
Action. So with that being completed, I make a motion to dismiss the meeting and go forward. All in favor? Aye. Have a great weekend, everybody.
You too.
Thanks,
Feel
everyone.
better.
I'll see you guys tomorrow. Same pet.
Yeah.
Take care.